Hi, this is Terry Kuti, founder and director of Deep Sea Foundation. I want to welcome you to the educational YouTube channel where we discuss various topics related to breast reconstruction for those affected by breast cancer. I'm very happy today to share with you a personal story. Personal stories from patients mean a lot to us because I think that women and men who are planning their reconstruction, the voice from other patients resonates with them. They have different topics and experiences that sounds familiar. So today, I really would like to welcome with great honor Tara Dalton, who is joining us today from New York.
Hi, thank you so much for having me.
Oh, Tara, thanks for being on the program. We're at opposite ends of the universe, you in New York and I'm in Seattle.
I know, and I love Seattle so much. I'm so jealous of you being there. It's a great city.
Well, you can come see me next time you're here.
I would love that.
Yeah, after we get through the crazy pandemic. Well, I really want to thank you for joining us today. And what I'd like for you to do, Tara, is begin by telling us your story to have a mastectomy with your, or you didn't choose to have a mastectomy. You had a mastectomy for prophylactic reasons, and you had an initial breast reconstruction. Can you start out by telling us that story and why you did it?
Sure. So my mother actually was diagnosed with breast cancer. I believe it was 96. And we lost my mother to breast cancer in 98. I was 18 years old, and, she lost her mother at the same age. So she was also 18 when she lost her mother. So it just seemed like this dark cycle that was going to keep happening. And I had a lot of family members, and my partner at the time was encouraging me to go and get tested for the gene. And I didn't really know, what that would entail or what the next steps would be if I was, to come up positive for the BRCA gene. I did. I believe it's BRCA2. I always get this wrong, but it's the one that carries the threat for ovarian and breast. Breast being the higher risk, and then like a secondary risk of the ovarian cancer. So I came up positive, and the surgeon who I was dealing with at the time didn't go on to be the surgeon that I actually dealt with. I went to see a secondary surgeon, but asking her what the options were, and she told me, we can be vigilant, we can wait and watch, we can, get you regular screenings and just kind of see what happens. Or, there's another option. And I said, well, my mother was vigilant, and I'm not comfortable with that option. What is my other option? And she said double mastectomy. And I thought she heard me wrong. And I said, no, for the gene, not for if I have cancer. And she said, no, that's what we would do, to prevent your gene from mutating or I guess to mitigate your risk of developing cancer. And I was blown away. I couldn't believe that was my option. I didn't see that coming. I don't know what I thought. I was 28 years old. I was, still kind of just a kid, I'm still kind of just a kid, but I was age-wise just a kid then. And I didn't really expect it. And I didn't really agonize over it too long, but I remember being really, initially very stunned by that prospect, and just thought, I know that my mother would want me to do whatever I could to safeguard myself from developing breast cancer. And so I jumped in with both feet, and in 2008 had the double mastectomy performed.
Seems like a really drastic step, doesn't it?
It sure does.
Because,
it sure does.
We lose body parts when we have a mastectomy. People don't think of that often because it's not always visual for everyone, like other amputees who might lose a limb. We lose body parts and they're concealed at times. Mm-hmm. So can you describe your initial reconstruction a little bit for us, Tara?
Sure. So as I said, I didn't see the surgeon who diagnosed me BRCA positive. I saw another surgeon. The initial surgeon was a woman, and this surgeon was a man. He was a very talented plastic surgeon. I went to see him, and I'm not sure if it was just what was offered at the time, or if he was just pushing the idea of silicone implants. You know, he said, we've got saline or we've got silicone, but I think you should get the silicone because it just looks more natural. But there was no discussion of nipple sparing. There was no discussion of any kind of deep flap. And I'm not even sure if they offered that. Maybe you probably know better than I do. But in 2008, it really, he didn't present me with many options at all. So
Well,
I elected. Go
yeah,
ahead.
and sometimes it's a matter of what surgeons specialize in. They can be extremely talented plastic surgeons, but it's just what they offer. If they don't offer it, then you wouldn't be given your options.
That's true. Right.
Yeah.
Yeah. Yeah. I do kind of seem to remember, you know, it's more than a decade since this conversation with him took place, but I do seem to remember him saying something like, um, if he did present that as an option, it was like muddied, and it was like he was trying to steer me away from, well, you don't want to, you know, there's other things, but like you don't want, you know, something like that. And he was a fine surgeon, and you know, I don't mean to be diminutive about that experience, but it really just was presented like, okay, silicone or saline. So I said, oh, I want to look natural, so let's
Right.
do the silicone.
It was just a matter of not having the full spectrum of options. So you have the silicone.
Mhm. Yeah, and you know, like I said, I was 28 years old, and I really didn't, you know, my main goal was to mitigate my risk. So you know, if there were things that I was a little worried about peripherally, I didn't really harp on them. You know, he said, you know, there's a good chance that you might lose some sensation. And I'm quoting him directly, you might lose some sensation. And so I just thought, well, that's a possibility, I suppose, but we'll see when we get there. You know, again, my main objective was to do what I had to do and take care of what I had to take care of. And I, you know, I thought about if there were collateral damages, like losing some sensation, I could deal with that. But I really was not prepared for losing all of my sensation. And so during the healing process, as I kind of went along, you know, I did try to take it very slowly, of course, and I was very gentle with myself and kind of really took my time, ate whatever I wanted, you know, took it really slow, and just kind of projected down the line and thought, well, I'll probably get sensation back at some point, you know, when I start to feel better. And then, you know, a few months pass, and then 6 months pass. And I think at a certain point, you know, I don't know, a while down the line after the initial surgery, I went, I don't think I'm going to get any sensation back here.
Tara, what was that like to be numb? I mean, what mind switch did you have to go through? It was a forced mind switch, of course, but what did that do to your?
It's strange because you would think that an experience like feeling more tender or feeling, you know, feeling more sore or something like that, or having, you know, amplified sensation would make you feel really vulnerable. But having no sensation made me feel super vulnerable. So I wouldn't know if I would bump into something. So I'd be really careful with the way that I moved through the world. I would be really careful about hugging people, because I knew that if I did compromise the implant, if I did puncture it somehow, I wouldn't feel a thing. And so I was just super, super careful. I had some friends into some contact sports, and I'm tall and I'm kind of a broad woman. So I was recruited several times to be on the roller derby team. You know, I've got tattoos, so I think they targeted me. But and I really wanted to try it, but I said, there's no way that I could do this. You know, I just couldn't. There were so many things, not just that's pretty extreme, but there were so many things that I just stayed on the sidelines for, because I had a shell around me, and it really did disconnect me from that part of my body. You know, you kind of start to compartmentalize, and I describe it as a sort of disintegration. And by that, I mean, I didn't feel like a solid whole person. I felt like I was in segments. So, all the parts of me that I could feel from here up, that was one segment. And then I couldn't, this was just kind of like a grayed out area. And then I could feel everything else below that. And so I just felt like I was in pieces in a way, And so, it was a strange thing to integrate into my reality and to kind of, and to kind of accept and move through the world with this added kind of just shell and padding around myself. So I was just hyper vigilant and extra careful all of the time.
That's very interesting the way you describe this. Each reconstructive surgery is so unique. But Tara, you had a secondary reconstruction.
Mm-hmm.
Can you tell us? Yeah. I mean, why did you
Yeah.
have the secondary reconstruction? And tell us the difference between that and your initial reconstruction.
Yeah, so despite my greatest care and moving through the world with the shell around myself, as I called it, the implants were compromised somehow. And I remember the surgeon telling me, you've got, some people's implants last 20 years, so I had 20 years in my head, and just thought, okay, I guess I'll just kind of keep this going until something happens. But it seemed fine. And then one day when I was getting dressed, I noticed in the cups of my bra, one of my breasts, my left breast, was slightly kind of spilling out of the cup. It was just kind of fuller on one side. It wasn't anything graphic or anything like that. It was just two very different sides, noticeable. Your body, so.
Yes, noticeable.
Yes, and so I said, "What did I gain weight just on one side?" And it didn't dawn on me because, again, I was so vigilant about taking care of myself and being really cautious that it didn't even dawn on me that it could have been a ruptured implant. But I went for an imaging, and that's exactly what it was. And when I tell you, I felt, I just felt like there was a ticking time bomb, similar to the way that I felt when I was diagnosed with the gene. Someone saying you've got the gene feels like, well, you've got to diffuse a bomb inside you. This felt this similar. It was kind of like, I don't know what silicone is going to do to my organs. I don't know what it's going to do. What if it goes to my brain? I don't. So I was really scared. And so I saw a surgeon up in the Hudson Valley where I was living, and she referred me down to a surgeon in Manhattan who is also a gifted microsurgeon, and which I didn't know at the time. I just went in to see her. She was lovely. I was so happy to be with a female surgeon, just because there are so many little things that she thinks about just having her own breasts that, a male doctor just wouldn't likely think about. And that's not a gender bash. It's just kind of the way that minds work. And so
you felt kind of symbiotic with her at the time after going through all this. It was a good match.
Absolutely.
Good.
Very, very. And I felt really confident in her, and she seemed to really care, which the way that things shook out, she certainly did. And so she discussed the DIEP flap with me, and I said, that seems like you're going to get, the doggy bag of having a flat stomach along with that package. So I said, sign me up. That sounds wonderful. And also the idea of using my own tissue felt really safe to me. It just felt like, okay, this is not a foreign body that can explode or rupture without any warning. So it just felt really good. And she also, the way that she kind of presented it to me at the time was, I'm going to attempt to reconnect some of your nerves. And I said, that sounds great, but it just kind of went over my head, and I just was, again, focused on the big picture. Let's get through this surgery. It's going to kind of be an intense one, lots of downtime, 6 to 8 weeks of recovery. So the thought of regaining sensation, it was like somebody saying, well, you'll get a dipping sauce with your sandwich. It wasn't my main focus. It was
And
like a nice little bonus.
yes, and Tara, you had a technique that used a resensation nerve graft to
Mhm.
restore this feeling. Can you tell us a
Yes.
little bit about what your surgeon did and explain that a little bit? Because here you were numb for
Sure.
10 years, and now she's telling you you're going to gain sensation back. That had to be,
Yeah.
yeah,
Yeah, it was exciting, but again, I was very cautiously optimistic.
sure.
Um, I wasn't, it's strange to say, but I didn't feel like entitled to sensation because I had given, I felt like I made a sacrifice for my long-term health, and almost like, okay, I'm not going to get excited about regaining sensation because I haven't had it for so long, and I can't even imagine what that's like. Yeah, but what she does, and I think she said it's not, it doesn't add a ton of time onto the procedure itself. Um, and she just takes two nerves and grafts them together. I wish I knew more about the exact science of it. But yeah, she's a skilled microsurgeon, and she slowly but surely, I think nerves grow half a millimeter a day or a millimeter a day. I don't know exactly, but
They,
they grow over time. And so, you know, as I said, the caring for yourself, as I'm sure the process of healing, you know, for me, it just takes all of my energy to just kind of stay the course and focus and take care of myself and give my body what it needs and just be really gentle. And so that was my focus. I didn't think, oh, I'm going to be able to feel again, until I think I was just watching a Netflix movie or something, and I got this kind of sharp pain. And I was like, oh God, is something wrong? And then I went, no, nothing's wrong. I can feel again. This is amazing. And so that initial kind of like poke was like the best feeling I ever had, because I knew that my nerves were coming back online. And so I knew, okay, well, I don't know if it's just going to be that little bit that's back. But I know that they grow really slowly. So maybe this will continue. And yeah, the healing process, you can start to feel, I started to feel tender, and so I knew that like the nerves were regenerating and coming back, and I was just blown away.
well, nerves do grow at about a millimeter a day, Tara, and the science behind it really is fascinating, because
Yeah.
what women don't realize is that your nerves are cut during mastectomy. And if you have reconstruction, you can get feeling back. And by
Hmm.
using this nerve graft that your surgeon, your very skilled surgeon, used over time, it's not immediate, like you said, because nerves, natural body function, they do have to take time to regenerate. But
Hmm.
over time, you get that sensation back. Amazing that you were numb for 10 years and now you have sensation back. Tara, what's your sage advice for women who, I know this is a big question, but what is your sage advice? Let's educate the viewers on what they should be talking to their surgeons about, not only their breast surgeons, but especially a plastic surgeon that they go to. What questions should they be asking, and what sage advice can you give to young women who are BRCA positive, or anyone for that matter who's facing a mastectomy and considering reconstruction? That's a big question.
It's a big question. Yeah. I mean, I still ask myself that when I speak to current patients who are looking at mastectomies, who are losing their hair, who are in the process of going through this huge sojourn. I would just say, Gosh, do your homework. And there's so much out there. There's so many resources. In fact, I think on the ReSensation website, there's a resource there that you can look for a surgeon that is, a registered provider of this service. And I would just say, look for that, and ask your surgeon if they perform it. I think I actually was talking to a woman who said that her surgeon wasn't performing it, but because she spoke with her about it, the surgeon began the process of looking into adding that into her repertoire, which is amazing. And if we can get more people,
that's
I mean,
patients right there at work. That's the voice of
yeah,
patient advocacy. That's amazing right there, what you did. Yeah.
yeah. Well, someone did it.
Yeah, I think what you say is so important, and just to circle back to that, because I feel the same way. You have to ask the question, and I think it's important for the viewers to ask if their microsurgeon, if they're considering DIEP flap, if they're considering breast reconstruction, if they perform nerve resensation, either by using the patient's own nerve, or if they need to use that nerve graft to provide that sensation, and ask the surgeon how often they perform it, if they're comfortable performing it, what their success rate is. So your story today is so unique and individual, because you had the opportunity to tell us, what it was like to live in that shell when you were numb, and then you chose a secondary reconstruction. What an amazing story, Tara.
It's been interesting. It's been quite a trip. Yeah. I'm just so lucky that my surgeon just includes that in what she does, because she cares so much about how women feel. In addition to, she's a plastic surgeon, so she's very concerned with appearances, and you want to look beautiful and you want to feel your best, but also how do you feel, and how can she help you to get as close to normalcy as you might have once been prior to your breast cancer, or pre-Viver journey, getting you as close to that feeling of normalcy and feeling like yourself again. That's the main goal, right? Is to just get closer to yourself again.
Well, it shows in your beautiful appearance today, and also just sharing your wonderful story. So I really thank you for joining us today, Tara. And if you have questions or comments on this video, please let us know, and let us know also if there are other topics that we can cover for you here at Deep Sea Foundation. Tara, thanks again for joining us today.
Thank you so much for having me. I really appreciate you listening to my story.
Absolutely. It was a pleasure. Thanks.
Same here.